My name's Casey Walker. I'm an attorney and I'm the principal founder of VA Disability Group. I'd like to talk to you today about chronic conditions. Very powerful and not really well known by veterans. Chronic condition. So what is a chronic condition? Well, where a chronic condition that's listed in 38 CFR 3.309 manifests to a compensable degree within a prescribed time period, that condition must be service-connected. So it's a fancy way of saying if you have it after active duty within a certain amount of time and it's one of the listed conditions, the VA must service-connect it. Very powerful. In most instances, a condition must begin on active duty. But here, we're talking after the fact. You're off of active duty. That DD 214 in that time period, we're after that. Within you, most of the conditions are 1 year. And so it's one of those exceptions to a condition and the symptoms must begin on active duty. So let's break that out a little bit. So the relevant regulations are going to be 38 CFR 3.307 and 38 CFR 3.309. Now, when you get into 38 3.309A, you're going to see a list of all these conditions that fall within the purview or scope of a chronic condition. You're going to be seeing conditions like arthritis, calculi, the kidney, bladder, or gallbladder. That's a fancy way of saying kidney stones. So if you have arthritis, kidney stones, really any cardiovascular condition, which is going to be the heart. So if your ticker's having issues, if you're diagnosed with coronary artery disease or arteriosclerotic heart disease, those would be two conditions that involve the heart. And then getting into hypertension, blood pressure. If your blood pressure starts becoming elevated on a routine basis, that would constitute a chronic condition. Epilepsies and seizures, cancers, most all cancers, ulcers. So if you got a bad acid reflux and you start getting some hematemesis or blood coming up, where you're spitting out blood, now you're in the chronic condition realm. And then we have this generic one that's found in this regulation. It's other organic diseases of the nervous system. What the heck does that mean? Well, it means anything involving a nerve, carpal tunnel, Bell's palsy. I had a veteran one time. She was pregnant towards the end of her active duty, and then within about 6 months of her leaving active duty, she got a severe Bell's palsy, which is that paralysis of the seventh facial cranial nerve. And she had to tape her eyes shut to sleep, and just a profound nerve issue of the facial nerves. And we ended up successfully getting that awarded service connection after the fact because of this exact regulation, because most of the conditions found in 38 CFR 3.309 are limited to a 1 year time period, and we see those time period constraints in 38 CFR 3.307. So let's take a look at that for a second. If you go to 38 CFR 3.307 and specifically go down to A3, and I'm going to read directly from it here. The disease must have become manifest to a degree of 10% or more within 1 year. And then it breaks out some exceptions. For Hansen's disease, which is leprosy, or tuberculosis, then you have a 3 year, so you even have more time. And then multiple sclerosis is a 7 year limit. So multiple sclerosis, if you've been off active duty for 7 years and you get MS, you have a claim. And that's pretty powerful from the data separation from service as specified in A2 of the section, which is really just when your DD 214 indicates you left active duty. What are some of these important considerations we got to really hone in on? Well, it says compensable degree. So what's an example of something that might not be compensable? So we notice that arthritis. Arthritis is one of the conditions. And let's say you're having difficulty breathing, you might have pneumonia, you're really sick, you go to the doctor. The doctor does a chest x-ray, and that chest x-ray finds incidental cervical neck arthritis. Okay, so arthritis of the neck, you're not symptomatic. You're not complaining about the neck, you're not having any pain, but they see that it's arthritic, which is the narrowing of your joint spaces. That's incidental. That would not be to a compensable degree. So that would be but one example. There has to be some symptoms there, some ow, some uncomfort, some woe is me. There has to be some there. It can't be incidental. So that's what it means by a compensable degree. And then another consideration is what we're talking about here is conditions that begin after active duty. Well, it stands to reason that when these conditions happen on active duty, to a compensable degree, they must be service-connected. So that's just a logical implication. Some other considerations is if you are getting ready to leave active duty and you think that you do have some issues with joints or pain, it's probably good to get some assessments to document if you have arthritis or if you're having some type of stomach issues, maybe document. Maybe you're having gallstones or kidney stones or something. But if you can document something on active duty, then they're going to be stuck. They bought the farm, so to speak, if you can document these things on active duty or within 1 year of separation. Another consideration is these are not presumptive conditions. They kind of have a similar force and effect and functional impact, but these are not presumptive conditions. So the VA is set up and has created a litany of different regulations and statutes, so is Congress, that creates presumptions. So you have Agent Orange presumptions, you have Gulf War presumptions, you have Camp Lejeune presumptions. Those are to suggest in most instances that if a veteran ever gets a condition, and they served in the right period during the right time, then they must be service connected for that respective condition. This is not a presumption. This is a chronic condition. So there is a nuance there, and these things are temporally limited based on 3.307. So that's all I have for you today. I hope you found this helpful. If you like this video, like and subscribe to the channel. Thank you for watching. Comment below. Have a good day.